Hello and welcome to Q&A with CNA. I'm Kyle Schwartz, and my guest for this month is Dr. Liz Hayford, and we're going to talk about what she actually does at Child and Adolescents, but we're going to start with her background because we've never had you as a guest. So tell us where you grew up and where you went to college and that type of thing.
Sure. So I'm from a small town, Fredericktown, which is about an hour. Yes, it's very small. We have 3 stoplights, but only need 1. And my dad is a family physician, so I knew that I wanted to be a doctor, like for as long as I can remember.
That's cool.
And I went to Neomed, which
in Rootstown.
Yeah, in Rootstown, because I knew that I wanted to be a doctor. So 2 years, 2 summers. And was able to do that. So I went to Youngstown and then to Neomed for school. And then actually I became a family physician first.
Oh, really? Well, that's interesting.
Yeah, and I actually did family medicine in Alliance. But my favorite people to see were those who struggle with depression or anxiety. And so I went back to school and did psychiatry. And so now I am medical director at Child and Adolescent, and I love it there.
Okay, so that covers probably a wide range, being the medical director there.
Yes.
Yeah, okay. So how long have you been with Child and Adolescent?
It'll be 4 years this summer.
Okay. All right, well, tell us about typically what you do in a day. I know it's never typical, and especially this last year.
Yes.
But kind of talk us about some of the things that you do and some of the people that you work with.
Sure. So I'm really fortunate to get to see a lot of clients who struggle with depression, anxiety, ADHD, significant mental health issues. But I also supervise nurse practitioners who are seeing clients with those similar struggles. And I go to a fair number of meetings to try to...
Oh, you don't escape those either.
No, no. And I get to work with therapists and case managers, and in our medical department we also have RN Meredith Scotcher, who has been at CNA for 25 plus years. So I'm really fortunate to get to work with a lot of people who want to help others.
It's always amazing to me at the staff that you actually have there, how many people, you know.
Yeah.
I think when we started this program, you know, I thought, oh, you know, 10, 12.
Oh, no.
Have way more than that. We've interviewed more than that.
Yeah.
That have different positions there.
Yeah,
but
probably 140 plus.
So your main office is in Canton?
Our main office is at Belden for the medical department. We do also have a nurse practitioner that comes out to an Alliance office. So we do have services available in Alliance. CNA as a whole also has an office in Plain and an office in downtown Canton, our Shipley office. So 4 locations.
So, you know, this year, you know, with COVID and everything was probably a challenge for everyone. And so in what you do, working with kids with depression and that type of thing, tell us, you know, some of the things that you saw and how you helped them.
So I think one of probably the best things to come out of COVID was the opportunity to do telehealth. So it really became more available. And so being able to see kids that we wouldn't necessarily get to see otherwise, either they're feeling sort of sick physically and maybe would have to cancel their appointment, we could do. Or let's say, like I had one person that was on a trip to California, but because we could do telehealth, we could still make that visit a reality.
And do you think some of the kids maybe feel more at ease actually doing it that way rather than sitting person to person?
Yes, yes, I very much do. There's a comfort of being in your own home. And somebody yesterday didn't want to get out of bed, and I don't blame them. It's early on in summer. And because of telehealth, we were able to do the appointment even though they were not wanting to get out of bed. So.
Okay, so do you see as many clients during the summer as you do during the school year?
I would say yes and no. In some ways, we might see even more, like sometimes college kids coming home, and that way people don't have to miss school. But there's more flexibility, I would say, because some people are like on vacation and maybe are feeling less anxious because they're not in school, and so they have more, I guess, positive feelings and don't necessarily need to come in to the office.
All right, well, we'll talk about the negative and positive aspects of your job. We'll start with the negative. What are some of the hardest parts of what you do?
I think it's hard when you see somebody who is really struggling, and medication maybe is just not enough. I think that's really hard, because I wish there was like a magic pill to fix relationships and things that just are not fixed with the medicine. And then personally, notes, like documentation, that's my Achilles heel.
Yeah, I can see where you have to do it, and they
You
have to be
have to do it.
detailed, but it must be hard. Okay, so but what are some of the brighter spots of your job? Why do you do what you do, and what do you like most about it?
Well, I really do like helping people, and I love it when somebody is anxious and maybe afraid to go out in public, and then they could go to graduation and feel more confident, or if somebody is initially pretty depressed, are able to sort of come out of it and be able to see that silver lining. Yeah, I like the successes, and I think that's one of the best things about working in the child and adolescent arena, is that there is just so much hope.
Right, because they could get it earlier, right?
Yes. Yes.
Yeah. So if somebody would like to talk more with you or find out more about CNA, how do they contact you?
So I work at the Belden office, and the easiest way probably would be to call the phone number, which is 330-433-6075. And if you want to talk to the medical department, Meredith Scotcher, you would just ask for medical, and they'll give you to Meredith, and she'll get you to me.
Okay. Well, was there anything that we missed or that you wanted to add before we close the program?
I think child and adolescent is a wonderful place to work, and I really do think that we can make a difference in a positive way.
Okay. Well, we're very fortunate to have you guys, coming to our schools, coming to our town, and reaching out in the whole community. And thank you, Liz, for all you do.
Thanks for having me.
And thank you for watching Q&A with CNA. I'm Kyle Schwarz.